Good day, sir. I'm Grace Tayo po, your nursing aid for today, and today I will going to demonstrate inserting a straight or entwilling catheter to a male patient. So, for assessment, first we're going to assess the client's status, such as when clients last voided, then level of awareness or developmental stage. Next, mobility and physical limitations, then bladder distensions, any pathophysiological conditions and allergies, and last sex and age. Then we are going to also review the client's medical record, including the physician's order to verify if it was for that client. Then afterwards, for planning, we need to gather all materials needed and bring to the bedside, place on the table to save time and effort during the procedure, and explain the procedure to the client, what we're going to do, why it is necessary, and how he can cooperate, so that we will have a procedure easily. Then afterwards, for we need to provide privacy to the client, closing the curtain around bed and close the door if applicable. For implementation, wash hands. Then next, while facing the client, stand on the left side of the bed if you are left-handed. But if you are right-handed, you'll stay in right side of the client. Then place the side rail on opposite sides of the bed. Then close the um, cubicle or room curtain. Next, place the waterproof pad under the clients. Next, position the client. So we need to assist the client in supine position. Cover the upper trunk with bath blanket. Then at the lower extremities, cover with bed sheets. Then with uh, only the genitalia exposed. Then next, for inserting indwelling catheter, we need to open the package containing drainage system and place the drainage bag over the edge of the bottom of the bed or bed frame. Bring drainage tube between on the uh, side rail and mattress. Then next, we need to open the catheterization. Then open the catheterization kit according to the directions and aseptic technique, and place the waste receptacle within reach. Next, then gloves. After then gloves, organize supplies on sterile field. Open sterile package containing catheter. Then we have to pour the sterile package on of aseptic solution in the correct compartment containing the sterile cotton balls. Next, a lubricate tip of the catheter and remove specimen. Then after that, we need to um, petrified syringe from collection compartment. Then uh, set them aside on the sterile field. Afterwards, nurse may want to inflate um, the inflatable balloon of the catheter. Then by we we will know that when inserting the syringe into the catheter with syringe um, uh, with fluids on it to know if it was working. This one we will look at this one if it was inflate when we inject the fluid in. So here, this happens. So it was working. So after injecting it, we have to intake it, aspirate the fluid so that we can do the next procedure. So we need to aspirate all the fluid into the catheter. We need to inflate the lumen. There we go. That's alright. Then we need to remove using fishing method so that we are safe. Then next, we need to drape the client, apply sterile drape, just expose the perineal area. And then place sterile tray and content. So the tray is here. Then we need to place it in the between tights. Then next, we need to determine the catheter tip is properly lubricated. The male should be 12.5 to 17.5 and centimeter, which is 5 to 7 inches. So before we put it there, we need to clean first the urethral meatus. If the patient is not circumcised, so we need to retract the skin and with the dominant hand, we will it. This is the one who will grasp the uh, shaft, the penis shaft, shaft. Then grasp penis like that, just below the glans, and then we just stay put our hand in this position with dominant hand pick up the cotton balls, and then we need to clean it the urethral meatus. Then we need to repeat it until it was clean. Afterwards, um, we need to pick up the catheter and with the uh, dominant hand 7.5 to 10 centimeter, which is 3 to 4 inches from catheter tip. In this way, we can grab it with a forceps if we if we it depends on us or according to procedure or the physician. Then next, for insertion of the catheter, we need to lift the penis. Then position it in perpendicular position, and then ask the patient to near down to void when we are going to insert it. Then we are going to slowly insert it. Next, advanced catheter 17.5 to 22.5 centimeter, 7 to 9 inches. And then for adult, it was 5 2.7 centimeter to or 2 to 3 inches for the young people. Then when urine appears, advance scatter for another 5 cm, which is 2 inches. Then do not force if there is resistance, because if we force it, it will harmful to the patient. Uh, then the urine will be bloody. And then if that happens, we will going to remove the catheter and to prevent harm in the client. Then lower the penis, hold on catheter securely with the dominant hand, and we are going to put this one here in the urine tray. Then collect urine specimen as needed. At least 20 to 30 ml. Then if we gather the needed amount, we just pinch the catheter to stop the uh, urine drain. We need to just pinch. Then next, um, just we just do this to for temporary stop the urine, then release catheter to allow remaining urine in the bladder to drain into the um, collection tray. And we need to cover the specimen and put in the side. Then next, allow the bladder to empty full about 750 to 1000 milliliter, unless the hospital institution has policy to strict maximal or just the amount they have in the policy. And afterwards, for a straight single use, um, pinch catheter and remove slowly at smoothly um, when urine cease to flow. Then next, for indwelling catheter, inflate balloon of indwelling catheter. So we need to inflate it um, so that it will not easily to remove. So we need to hold this one with the non-dominant hand, then insert. We're going to do this so that it will inflate and will not remove easily without the physician's order. Then Afterwards, after the solution is injected, so we're going to remove if the right amount to inflate the catheter is already on it. Then attach end of catheter to collecting tube. So we're going to attach this one into the um, collecting bag. Then after attach the tube for bag, the bag should be in lower level. This one. So we will putting this one lower. Then we are going to tape the catheter in the tight of the patient so that it will not go what we call that one. We are going to tape the catheter tubing on top of that tight or lower abdomen so that it will not allow to slack easily or move when the client is moving or any movement to detach it or to touch the tube. So it will not going to create distress. Then be sure that there are no obstruction or kinks in the tubing. So we're going to tape. Then afterwards, place excess coil or tubing on the bed and fasten it to Bolton sheet with clip from drainage. Then set or with rubber band or safety pin. Afterwards, we're going to remove gloves and dispose all equipments that is used. Afterwards, we're going to assist the client in comfortable position. We're going to drape. instruct, then afterwards, um, wash. After washing the uh, perineal area if needed, next we're going to instruct client to ways to lie in bed with catheter,